This week on Medicine in Minutes, we're going to take a closer look at glioblastomas. But first, before we begin, let's take it back to the basics. Anatomy. If you had to give your own definition of what the brain is to some random stranger, what would you say? The brain is an organ that is composed of a large mass of nerve tissue. It's protected by the skull. It plays a vital role in just about every major body system. It contributes to almost every life function, but one of its most unique features is it makes you you. The brain has two major compartments, the cerebral cortex and the cerebellum. Nerve tissue is composed of specialized cells known as neurons. But did you know there's other types of cells that are found in nerve tissue? They're called glial cells, or neuroglia. However, these cells are not a part of the conducting system. There are two main types of glial cells, microglia and macroglia. Microglia function as the brain's immune cells, and they identify when something has gone wrong and initiate response to remove the danger. The term macroglia gives rise to unique glial cells that each have a specialized function. These include astrocytes, oligodendrocytes, epidermal cells, and radioglia. Now, there are additional macroglia that are found in the peripheral nervous system. However, the brain is a part of the central, so we're not going to worry about those right now. Astrocytes maintain a neuron's working environment. They do this by controlling the level of neurotransmitters around synapses, controlling the concentration of important ions like potassium, and providing metabolic support. Oligodendrocytes produce the myelin that's wrapped around neurons in the CNS. Myelin allows for a faster signal transduction. Epidermal cells produce cerebral spinal fluid. Radial cells serve as progenitor cells to give rise to new glial cells. So now, what does this have to do with brain cancer? Well, when cancer presents in the brain, it's in the form of a tumor. This tumor develops from mutations in DNA within cells, such as glial cells. These DNA mutations cause normal brain cells to become abnormal, and these abnormal cells undergo rapid cell growth. The cell growth results from the mutation causing an increase in promotion of cell division or the loss of the cell's ability to inhibit cell division, kind of like flooring the gas pedal or unable to work the brakes. Glioblastomas are brain cancers that arise from mutated glial cells that grow out of control. They are fast-growing tumors. Glial cells are located in almost every aspect of the brain. Therefore, as the tumor grows, it's able to easily spread. Glioblastoma is the most common malignant primary brain tumor in adults. The median age of onset in individuals who develop a glioblastoma is 55 to 60 years old. Even with maximal therapy, high rates of reoccurrence and a poor overall outcome with a survival of 1 to 2 years is seen in most patients. The exact etiology that causes the DNA mutation in rapid growth of glial cells to form glioblastomas is unknown. There's some ideas that receiving radiation earlier in life could place an individual at a higher risk for developing a glioblastoma. Specific symptoms associated with glioblastomas are headaches, seizures, memory or thinking problems, vision changes, language problems like trouble finding the right words, and personality changes. The process of diagnosing a glioblastoma following a patient's initial presentation begins with the MRI or CT scan to show that there is a physiological abnormality causing the patient's symptoms. The tumor appears dark in a CT scan and white in an MRI. Next, a biopsy is completed to confirm that a patient does indeed have a glioblastoma. This is done by identifying that the cells on the tumor are similar to glial cells. This can be completed during surgery to resect the tumor, or if a patient can't have surgery, a needle biopsy can be completed. The identification of the type and the stage of the cancer is essential in determining the necessary treatment. Treatment can include one or more of the following. The primary indication for treatment is surgery. During surgery, doctors take out as much of the glioblastoma as they can. This can help with symptoms and help the patient live longer. However, surgery is a major risk because it can hurt healthy areas of the brain. Chemo and radiation is typically given in addition to surgery, and chemotherapy is usually continued for 6 months after completing radiation. Another treatment option for patients with glioblastomas is electric fields. These are devices that are directly inserted into a shaved scalp, and they give off low-strength electric fields around the tumor. However, a patient must wear this device for at least 18 hours a day. Additionally, glioblastomas can cause seizures and brain swelling, so medications are given in prophylactics to prevent these symptoms. While glioblastomas are not the worst brain cancer out there, they're surely not the best. However, the most important prognostic factor affecting the outcome is a patient's age. Younger patients tend to have a better prognosis than elders. Other factors that affect the prognosis is the patient's performance and compliance and potentially genetics. It has been shown that patients diagnosed with the MGMT promoter methylated glioblastoma have a poor prognosis due to a worse response to treatment, in comparison to those who are diagnosed with the IDH enzyme positive glioblastoma, who have a better prognosis due to a better response to treatment. I hope you all enjoyed this week's episode of Medicine in Minutes. Thanks for watching.
Oh man, that was great! Hank, you've gotta watch the show with me next week.
Oh man, I can't believe I missed the show.